So as you can see in this young girl, that the upper face is kind of sunken in a little. The upper jaw is then retruded as a consequence of that. And not only the profile is not so harmonious, but you'll see effects in the pictures inside the mouth as well. Here we have superimposed the X-ray on the side with the patient's actual photo, and you can see that the jaw structure is kind of showing you what's happening in the soft tissues in the facial area when you look at the patient directly. So you can see the sunkenness of the bones of the jaw have also affected the facial profile. So when we go inside the mouth and take a closer look at things, you can see all is not too happy. The lower jaw, the teeth in the lower jaw are now outside of the teeth in the upper jaw, and there's a crossbite involving a whole group of teeth. Do the results last. This is the same patient after treatment, a couple of years later in review, and you can see that the teeth are now in the proper position, and this also affects what you see in the photographs of the external part of the face. Even if we didn't show you any x-rays, even just by looking at the photographs of this patient, you can see a really big improvement just by treating or intercepting for problems earlier rather than later. So let's have a look anyway what the results are if we superimpose photographs of the x-ray onto the profile of the patient before and after treatment, just to compare. And you can see here an improvement, even long term, that's held on a little bit later on in life. After the patient's completed treatment, we've just taken some radiographs to monitor her growth, and you can see that there has been not only an improvement, but it's held up over time. So don't leave jaw mismatch problems to fester. It can cause severe issues later. Come in early while your child's teeth are developing. So we looked at an underbite problem in the last case, but problems in the reverse can also happen. So you could have an overjet or an overbite where the upper teeth are sticking out. This will also cause problems and have effects on the airway as well as irritated gums. So don't leave jaw mismatch problems to fester. It can cause severe issues, as we can see in this next photograph. Before we go into the next case, this middle-aged person which has an overjet and an overbite is at risk of losing his upper front teeth because of the trauma caused by the lower teeth scraping against the upper gums. So you can see that this really can lead to problems later on in life. So in this case, we have a kid with a very retrusive lower jaw. He's breathing through his mouth because can't really get a lip seal because the lower jaw is so far back, and the lower lip is getting trapped behind his upper teeth. So by pushing his teeth into position and allowing the jaws to kind of grow around it, so we're trying to push the lower jaw a little bit forwards. So we're depending on growth, on his growth to be favorable in this case. But it's happened, and you can see that now he has an appropriate overbite. So his upper teeth are overlapping his lower teeth with sufficient clearance, and the overjet, the amount that the upper teeth stick out, has been reduced.
So there's always the question of when is the right age of bringing your child in to see the orthodontist. And we agree that it would be around the ages of?
Roughly around 7 to 12. Around these ages are great, especially when the very first permanent teeth are coming through. Once they lose their milk teeth, start losing their milk teeth, bring them in to see us.
As we've mentioned early on as well, interceptive orthodontics can often prevent the need for more serious or a more comprehensive round of treatment later on in life. But that's not always the case though. Sometimes adults may still come in again for another round of treatment.
Yeah, definitely. And even though our tools and our digital tools such as with white smile clear aligners are getting better, sometimes teeth are still rotated inside the bone or they develop in a weird position, so more treatments required later. But in a nutshell still, I think it's still wise to bring your child in early, as you've seen in our previous cases, for a screening or to at least assess the potential for some interceptive treatment. And there you have it, a brief overview of interceptive orthodontics and how it can benefit your child's dental health and even your child's dental future. So if you think your child may benefit from what you've seen so far in interceptive orthodontic treatment, be sure to schedule a consultation with us. Thanks for watching, and we'll see you all next time. Also, please don't forget to like, share, leave a comment, subscribe, and tell us what topics you'd like us to cover in the comments below. And until next time, take care of those smiles, and we're grateful to have Dr. Arvinder and our team with us, and we look forward to seeing you all very soon.
Thank you very much. We look forward to seeing you in our clinic.